Hi guys, it's Amber Sanders. I'm going to be talking about the role of the public health nurse regarding not only the meningococcal B vaccine, but vaccinations in general. So we have learned that there are 3 levels of prevention, and the public health nurse at this level is practicing at primary prevention. So this has to do with healthy people and just health promotion and practice. So vaccinations keep people healthy, and that is why we're definitely working in the primary prevention level. The 3 core functions of the public health nurse are assessment, policy development, and assurance. So regarding the meningococcal B vaccine, we can use the study at Princeton, or the outbreak at Princeton, as our example. So their assessment was seeing that there was a need for this vaccination, even though it was actually not approved for the FDA. You know, they knew it was out there, it was in the testing stages, so they applied for designation breakthrough status, and they got it. So they saw that there was these 9 cases of bacterial meningitis. It resulted in 1 death, and they knew that they had to do something about it. So that was the assessment part of it. And then, although it didn't, this outbreak in particular didn't develop into a policy, there was the policy that California passed that they had, the student at least had to be educated about the vaccination, and they had to know about the availability of the vaccination, and then the university had to document whether or not they wanted to actually get the immunization or not. There are, I think, 4 or 5 states that actually make it mandatory for college students that are residing on campus to show proof of the meningococcal B vaccine, but California isn't one of them as of yet. And then the assurance aspect of it has to do with monitoring health outcomes. So with Princeton, they did do follow-up, and they did take blood samples from, I'm not entirely sure how many, but they ended up following up and taking blood samples from some of the students who, a good majority of the students who actually decided to get the vaccination, and they tested for seropositivity. And that's when they found out that, 66% of the students who received the vaccination showed some bactericidal activity, but 33% showed no activity whatsoever. And then the 10 essential services of the role of the public health nurse. A lot of this it's based off of the 3 core functions. So it's monitoring health. We talked about that in assessment. Diagnosing and investigating, same thing. Talked about that in assessment. You see a need and you feel the need. Inform, educate, and empower. We all know that knowledge is power. So the more you educate your patients, the public, your family members, whoever it is, the more, empowered they feel to be able to make good decisions regarding their health or their family's health. Mobilize community partnerships. So this is a lot of collaboration. This also works with link to and provide care. So you want to inform the public about where they can get these vaccinations and immunizations, whether it's an immunization clinic, your physician's office, CVS, Walgreens, Costco. You want to point them in the right direction to let them know that vaccinations are accessible and affordable. Develop policies, we talked about that. Enforce laws. This has to do just a lot with the vaccinations, even though with the meningococcal B vaccine, it doesn't really have, there's no laws pertaining to it other than education and documenting whether or not the student received the vaccination or not. But this definitely came into light after the measles outbreak at Disneyland in 2014, and California got rid of the legislation, or California passed legislation to get rid of the personal belief exemptions. So they still allow for medical exemptions, and that's kind of now even causing a problem, because a lot of people are getting medical exemptions because they just don't want to vaccinate their kids. So enforcing laws regarding immunizations falls on the school officials, health officials, your physicians, pediatricians, but mostly the school officials, just because I know that when I was registering my daughter for 7th grade, we couldn't even pick up her schedule until I showed them proof that she had gotten her booster shot for her Tdap. So, and I'm seeing that a lot now, even in my preceptorship at the school that I'm working at, because it's a middle school, and I'm having to work with a lot of the 6th graders and send notes home asking for their updated shot records showing that they've gotten the booster shot for their Tdap. Assuring competent workforce. So this doesn't have to do with educating the public. This has to do with educating the people that are working with the public to know and see when there is a need and to how to fill that need. So this, in the case of the meningitis vaccine at Princeton or UCSB, probably was working with the school health officials, teaching them the signs and symptoms of meningitis, teaching them the proper way to administer the vaccine, potential side effects of the vaccine, and not even just the school health officials, but also even RAs or people that are working in the dormitories to look for signs and symptoms of meningitis and look for potential outbreaks. So evaluate and system management and research kind of has to do with the assurance part. The core function of assurance. So this has to do with just monitoring the health outcome and providing data to the public as to why we need these vaccinations. So it's why the pertussis booster shot came into play, because we realized that there was a pertussis outbreak and they decided they needed a booster shot at 7. With the measles outbreak, you might need a booster. So it's just a matter of providing the data and the scientific-based evidence to the public to show them why these vaccinations are in need. So we will talk about patient education next.